here today, and I'm very pleased to be here today with Minister Anne Rabbitte and with Bernard Gloster to publish the Action Plan for Disability Services for the period 2024 to 2026. When responsibility for disability services transferred to my department from the Department of Health in March of this year, it was an important priority for me and for Minister Rabbitte that this would mean a tangible difference for people who used and indeed who need disability services. And fundamentally, bringing disability into my department meant that for the first time, services, policy and rights would all be under the same roof. And it's that rights-based approach that is central to what we're seeking to achieve. Ireland has ratified the United Nations Convention on the Rights of Persons with Disabilities, meaning we've made a commitment to protect and promote the full enjoyment of all human rights by people with disabilities. Since its ratification in Ireland in 2018, we've taken great strides in the development of services and supports for people with disabilities, their families and their carers to ensure that they are aligned with the principles set out in the UNCRPD. A critical milestone was the commencement of the Assisted Decision-Making Capacity Act of 2015 and the Amendment Act of 2022, and that commenced on the 26th of January this year, and that brought the concept, that Victorian concept of wardship, to an end in this state. And furthermore, in fulfilling the programme for government commitment to develop an implementation plan to coordinate implementation of the UNCRPD, the development of a successor strategy to the National Disability Inclusion Strategy is underway with targeted stakeholder consultation focused on disabled people's organisations. As a department, we're developing an autism innovation strategy which will provide a framework for cross-government action on autism. My department also funds the award-winning Access and Inclusion model, AIM, which has supported more than 27,000 children with a disability to access and meaningfully participate in the Early Childhood Care and Education programme since 2016. And the successes of that scheme is why I was so pleased to secure additional funding for it in 2024 to ensure from September of next year the AIM scheme will be expanded. However, we all know that more needs to be done. And in 2021, the government published the Disability Capacity Review to 2032. And this review set out the extra capacity required in disability services to address demographic change and provide for unmet need. It is the main evidence base underlying the measures set out in the action plan being launched here today. When we talk about unmet need or demographic change, what we're actually talking about is the profound frustration that is faced by so many parents around the country in getting therapies and getting those interventions to which their children are entitled. And we have to see change in this area, and we have to see improvement. And complementing the recently published Roadmap for Children's Services, this action plan will expand the capacity of Children's Disability Network teams by approximately 600 additional staff in its lifetime. There will also be efforts to increase the disability service workforce overall. A group has already been set up, chaired by Minister Rabbitte, to address workforce concerns and examine ways in which we can improve recruitment and retention in the sector. In order to support people with disabilities and their families, we're also expanding respite services, as well as looking at different ways in which we can deliver respite. The publication of the action plan today represents an important moment following the transfer of functions, providing us with a pathway for the development of service delivery and policy over the next 3 years. It's important to note that this isn't the height of our ambition, rather it represents the first phase in progressively addressing the deficit in service delivery that currently exists. This plan will create the foundation for expansion in service capacity over time, including through the successor plans in the period after 2027. This long-term view is essential, and it demonstrates our commitment to deliver real, impactful change for people with disabilities in Ireland. So I'd like to thank you all again for attending the launch today, and I'll pass over to Minister Rabbitte.
Thank you, Minister O'Gorman. So it gives me great pleasure to be here today with Minister O'Gorman and Bernard Gloster to launch this Action Plan for Disability Services 2024 to 2026. I have learned so much from my time as Minister for Disabilities that the most important thing I have learned is that people with disabilities and their families need action, and they need it now. They need more services, they need easier access to services, and they need assurances that their voices are being heard. And it is with that we want to achieve this plan. As Minister O'Gorman has stated, the Action Plan responds to the Disability Capacity Review published in 2021, and it sets out our ambitions regarding to expanding capacity in disability services and addressing the unmet need. While we have significantly increased investment in disability services in recent years, people with disabilities, their families and service providers have told us that a lot more needs to be done. Specifically, they need to see a pathway for continued investment and clear targets for delivery. This action plan provides that certainty for the next 3 years and demonstrates government's commitment to this important area. The 3-year plan includes ambitious targets across a range of services areas, including building capacity in the Children's Disability Network teams through the recruitment of 600 staff, 800,000 additional personal assistant hours and 110,000 additional hours of home support to help people live independently, providing 1,200 day service places each year so that school leavers are supported at this critical transition point in their lives. An additional 1,400 residential placements over the course of the plan, including 500 to move out of large institutional campus-based settings. Additional investment in respite services, including exploring ways of maximising the impact of that investment through alternative methods of delivery. There will also be an increase in posts in specialist adult therapy services and the development of a nationwide network of neuro-rehabilitation services. The plan also includes important enabling actions around improving the data we use to plan services, the implementation of better technological financial systems for better oversight of spending, and a working group to address workforce blockages, amongst others. These enabling actions will engage in the early stages of the plan in order to accelerate delivery in the later stages. And as you can see, it is an ambitious and a challenging plan that we have set ourselves, and there will be a lot of work required to advance these objectives, but we are committed to delivering on it. In recent years, significant resources have been invested in disability services, with over 700 million in additional investment provided between 2018 and 2023. Building on this, an unprecedented level of funding of 2.9 billion for disability services has been allocated for 2024. This reflects this government's commitment to strengthening the funding provided for the disability sector and addressing the known shortfalls in service provision. As part of Budget Package 2024, funding has been allocated to deliver 100 residential placements for children and adults, an expansion of the respite services, between 1,200 and 1,400 new day service places, 8.5 million for the development of children's services, and an additional 80,000 personal assistant hours and community neurological teams. This action plan was developed by an interdepartmental working group with officials from the Department of Housing, Further and Higher Education, Social Protection and Health. In the first instance, I would like to thank those departments for their work in developing this action plan. Disability is not just something that concerns health, or social protection, or housing separately. All of these areas must work together in an all-of-government approach in order to deliver on the needs of those with disabilities. And that is why this plan includes actions in relation to helping people into employment, improving residential services, and ensuring that people with disabilities have access to mainstream health services with clear pathways as appropriate. As the respondents from our consultation told us, it is essential that government departments work together and use joint up-thinking in planning services. So on conclusion, my ambition, along with Minister O'Gorman and along with the HSE, is to provide supports to people with disabilities so that they can live ordinary lives in ordinary places and have choice and control of how they use these services. As I have said, it gives me great pleasure to be launching the plan here today, and I am proud that we have produced an ambitious programme. But the real work begins now, and as we try to progress the plan and make a tangible difference in the lives of people who need these services. And the overall costing of this is 650 million.
Thank you. Good morning or good afternoon, everybody, and thanks to Minister O'Gorman and to Minister Rabbitte for the invitation to participate in this milestone launch of an action plan for services for people with disability. The plan very much connected, as the ministers have said, to the giving effect to the intentions of the UN Convention. Ireland, like many other countries, challenged by conventions, but just because we're challenged by them doesn't mean we should continue to aspire to fulfil their objectives. This action plan particularly reinvigorates but also brings together a series of previously individually and isolated attempted actions to respond to different parts of the many needs that people living with disability have for their full inclusion in society, for them to be able to participate fully and for them to be able to live a life based on self-determination and based on their wishes and based on their preferences and based on their full inclusion in the communities they live in and the communities around them and the communities they wish to participate in. Long gone, thankfully, are the days of repeatedly isolated services for people who have needs in the social care and in the health sector, be that people with a disability or indeed many other cases, people with enduring mental illness. And in this case, the case of disabilities, the inclusion of people, the real lived attempt for the inclusion of people in the workplace, the inclusion of people in access to education. And from our point of view as the state's delivery system of health and personal social services, it's of particular importance to me that we focus on some of the key themes that this action plan calls us out to do and that we're accountable for doing. And that starts at the very stages of the earliest possible intervention in the lives of children and the lives of families who support children with a disability. We know from the evidence of the world over that the intervention at the earliest possible point in time, that the correct supports gives the greatest possible chance in the later years of childhood, adolescence and adulthood. And so it is important that we start there. We also know that many people living with disability are challenged in how to be supported to live their lives and to live quality lives, and whether that's in the areas of personal assistance or personal support or access to various and new forms of respite care, whether that's in the areas of neuro-rehabilitation or other specialist interventions. We know that there is so much to do. We know that we have achieved a lot, but we know that there's an enormous amount left waiting for us to do. Since the transfer of functions to the Department of Children, Equality, Disability, Integration and Youth, I think a greater chance is there now for focus, for singular focus on the needs of people with a disability. But it is very appropriate in that department that it's the department also that's focused on equality. And that should never be lost on us when we seek to provide support systems for people who are challenged in the lives that they live, and in this case, people with a disability, be that physical and sensory disability or be that intellectual disability. It's also important that it's in that department which is also focused on children. We know from many debates in political and public discourse this year the very significant challenges that are there for so many children who need and wait for services. And they need and wait for those services because we're challenged in trying to reach the very high bar that we've set for ourselves. And it's a bar we'll continue to set for ourselves. And so I look forward very much going into 2024 that the HSE service plan will, for this year, for the first time, because we now have a new parent department, will have its own dedicated section of that service plan, bringing greater visibility not only to what it is we set out to do and what the Minister has challenged us to do and what the Minister indeed has charged us to do and funded us to do, but it's also a public articulation of the standards and the actions by which we will be held accountable and by which we will publicly account for throughout the year in terms of our performance. I have no doubt there are aspects of any plan where we will be judged rightly to come up short. That doesn't make the plan useless, it doesn't make it ineffective. What it does is it continues to be the motivating factor to keep challenging, to keep resourcing and to keep finding new ways to reach those very high standards. The very high standards of service delivery, not for us to say we've achieved them, but because the people who require those services have a right to those services. And we have to approach them and we have to approach their lives from a human rights perspective. And the Minister has very clearly set that out across the agenda that she has set for us. And so I'm really very heartened by the existence of this specific action plan, because it is a plan that's achievable and it is a plan that has very clear, very solid and very focused actions, which when they all come together bring us to that better place of what needs to happen in public services, continuous improvement. And I finish with the piece that I'm particularly pleased to see, the reference to inclusion in the formulation of the plan. And I hope there will be reference to inclusion of people with disability in the judgment of our performance against that plan and in any amendments we make to it in the future, and no doubt amendments will be made. but it is the inclusion of people who matter the most that's important, and we have to continue to do that. And I'm very happy to say that the board and I, as the CEO of the HSE, are very focused on the priority that we give to services for people with a disability. Many of you, members of the press, will know that I spend most of my time talking about very important things in healthcare, about hospitals, about waiting lists and so on, and they are all extremely important things that affect our citizens. But they are not greater than the access needs of people with disability for supports to live the lives they live. So I look forward very much to coming back in the various ways in the Oireachtas and in other formats, and accounting for our stewardship of this plan, which we have been very much supported by government as we face into 2024. Thank you.
She's there.
I just wanted to ask why you're publishing this plan on the 14th of December as the Dáil recess hits in within a couple of hours. So no chance to talk about it, no chance to debate it in the Dáil. Like, why, if people are waiting 3 years or 1.5 years or certainly over a year or two, why are you publishing it today? It seems strange. And I have a few questions. The second question is, that 64 million that was announced in the budget. So am I right in saying that's already set aside? Did you announce that already and there's nothing new there? And the third question is, how many people will receive residential support packages in the next 3 years under this plan?
I might come in just on the first two, and maybe Anne or Bernard might come in terms of
I do have a question for Bernard as well, just when the winter plan will be published.
Might come in with the package as well. So why today? We'd made a commitment to publish the action plan this year. It was delayed, and the reason for the delay was the transfer of functions. As we know, we'd hoped to get the transfer of functions done prior to March this year. It dragged on. Myself and Minister Rabbitte would love to have had the full move taken place earlier, and that would have allowed us publish the action plan earlier. We had a commitment that we would publish it this year. We're publishing it today. You're right, it is the end of the Dáil term. I have no doubt that the action plan will form the centre of debate, whether it's on the Joint Oireachtas Committee for Children with Disability, the Disability Matters Committee, and indeed issues of disability are discussed very significantly across the Oireachtas. So, I don't think publishing it today is going to in any way diminish the focus that will be on it, the justifiable focus, or indeed our determination to see it implemented over the next 3 years. And as I say, the budget allocation, there was the 64 million new developments, and then I think the additional 10 million as well. They were announced in budget 2024, and they will be implemented across 2024.
And in answer to your question in relation to residential spaces, so overall it's 1,400 residential spaces, of which 500 are part of the decongregation programme, Time to Move On, and there's 900 then for new residential spaces between adults and children. So we have allocated funding for approximately between 100 or 130 residential spaces this year, but that's to an order. This is a real signal to the sector. You can start building capacity, you can start planning, you can start actually, because we need the houses as well. The Department of Housing have a role to play here as well on this. So the figures would be we need 350 houses to actually mobilise this. So it's in order to allow the sector as well be able to engage in that space. So it's 900 and 500 Time to Move On.
I think it's 1,500, aren't there?
1,400, yeah. And look at it, and that then in itself will create more capacity for more respite. So it's all a knock-on effect.
I think just on the places, before I come to the question of the winter, just on the places, I think it's particularly important that the separation is there and the distinction between the two allocations. One is for decongregation. That has long been on the policy platforms and certainly for many years that I've been working in the health and social care services. And so I think that 500 is very achievable, but I think more importantly that we have a clear target that by 2030 to move away from that very institutional congregated setting model. On the 900, What's particularly encouraging about that is I spent many years in various parts of my career every year hoping and waiting to see how many emergency placements we would get for people for the following year. And what a dreadful indictment on us all that somebody's life that we can anticipate goes to an emergency to respond. This allows us to plan, it allows us to identify, it allows us to allocate, and allows us to allocate in advance, and that takes away some level of uncertainty for families and for people. But is it ever enough? We always know. We always know that need increases the intensity and type of need, but this is the first time I think we've had that clear plan on new places. On the question of the winter plan, I made a very strong, I think, commitment when I came to this post last March that we were departing from the annual festival of the winter plan, and I'm very happy that we've done that, and with the support of Minister Donnelly, I produced an in-year plan for urgent and unscheduled care in July of this year. We're now working through that, and that's what we will use to support the management of people's access to care through the winter, through the flu season, for children through the RSV season. We have very clear targets in it. I'm very happy that those targets are within reach, and starting from just a couple of days ago now, there's a 7-day-a-week senior management operational focus right at my level and right through Christmas on the management of unscheduled care. But there is no doubt we'll experience pressure this winter, but there isn't a winter plan.
Hi, Louise Byrne, the Irish Mayor. You say 600 extra CDNT staff, but obviously there's been quite an issue there with recruitment, retention. I know that the recruitment freeze that's going on in the HSE doesn't affect disability directly, but is there any concern that there might be knock-on effects with staff, moving, progressing, anything like that? And then, Mr. Gloucester, just kind of coming back to what you said there about the pressures this winter, I'm sure you've seen the trolley numbers that have been produced by the INMO over the last couple of days. I mean, you had nearly 750 the other day, 670 yesterday, nearly 600 today. Do you envisage a situation where we had 930 something last January? It was a new record. Do you envisage us getting up to that number again this winter? Do you think it could go over 1,000? Where kind of lays the feeling on that at the moment?
So the issue of staffing of our CDNTs is probably the biggest challenge we face within the department and indeed within the HSE. We've made provision in the action plan today for the financing of those additional staff. The key thing is actually finding the staff, and that's why myself and Minister Rabbitte has worked on the PDS roadmap, Progressing Disability Services roadmap that we published a number of weeks ago, which is absolutely focused on the issue of recruitment and retention of our existing staff. And that's being done through a number of mechanisms, through bringing in new grades like the assistant therapy grade, and they're actually funded within the NDM budget allocation that we spoke about earlier on. It's through master's programs, so someone with maybe a life science degree can qualify as an L or an OT in 2 years rather than taking the 4 years. It's also about opening up more college courses, more places on college courses, and we've had good engagement with Minister Harris. He did a big piece of work this year for doctors and veterinary and some other professions. Next year we're hoping to advance the area of social care professionals, therapists and the like, to open up more places there. So we're absolutely focused on increasing numbers, but then just the final point to make, retention is also important. That's why I think that the pay deal agreed between the Section 39s and Section 56s a number of weeks ago, which has been ratified by those unions, was important, because a lot of the CDNTs in the country are run by Section 39 organisations, and there was a significant pay disparity there, and the 8% pay agreement brings them closer in line, and I think that will be important for their retention as well.
Just to follow that on the staffing, because I'm conscious today, I very much don't want to take from people with a disability and their action plan. I will answer your question, absolutely. But just on the staffing, I think it's important to say that paradoxically, the recruitment pause in other parts of the health sector might help to focus the availability of roles and tasks within disability services. To be fair to government, it is one of the things they have been very clear with me that we shouldn't stop attempting to recruit. The other practical step that I'm taking after Christmas is my officials are going to be ensuring that, particularly in the areas of serious pressure, up in Inishowen, Plinson, North West Donegal, in Tuam and Galway, which was very widely reported on this week, and in other parts of the country, We operate a panel system because the recruitment licence requires us to do so. And so we sequentially go through the panel to see who will take a job. We're going to adopt the expression of interest approach after Christmas, which means a job, for example, in a CDNT in North West Donegal. That job will be sent out to 50 people on a panel, and whoever comes back first gets it, essentially, rather than sequentially going through. On the trolley position, I made it very clear in committee in the Oireachtas 2 weeks ago. I don't have any interest in engaging in a debate between the HSE and the INMO about which number is which on any given day. I don't think it serves the public interest well. It is to my concern that there's anybody on a trolley, and that there's anybody on a trolley for a length of time. What I have agreed, however, to do is from next week on, in a format that's just being finalised, is to regularly put into the public domain 4 categories of numbers associated with unscheduled care. That's the number of admitted patients in the emergency department, the number of admitted patients on extra trolleys up on wards, and those 2 combined are where our focus is. They're what's called unacceptable. And then the third category is what we call surge, dedicated space in a hospital we use as surge. They would be counted in the INMO trolley count, and again, not going to dispute that, but to us they'd be very different than a trolley in an emergency department. And finally, the number I intend to publish quite frequently is the delayed transfers of care. That's people leaving hospital. I've been criticised for some of my interventions in that, but I make no apology for the fact, because it's very obvious to everybody. There's a direct correlation between the amount of people delayed transfer and the amount of people waiting to get in to hospital from emergency departments. If we had no delayed transfer of care, we'd have no trolleys.
Do you envisage the situation is going to be as bad as last January, though?
I'm not countenancing that position. I'm targeting a position where the average daily trolley count of the first 2, that's ED and trolleys up the house, excluding surge, I'm countenancing a position where the average maximum would be 320 on a day. And we're also targeting and have already achieved massive improvements in the amount of people aged over 75 waiting more than 24 hours. Again, accused of lack of ambition on that, but I don't think it's a lack of ambition when you look at the people aged over 75, very frail people who last year spent 36, 42 and 70 odd hours on trolleys. So we're very focused on it. I'm not going to give false promises. From my perspective, we're going to hunt down every opportunity to have people waiting the shortest amount of time possible. And it's important to remember, we do not have a problem we have a problem in our emergency departments, but it is not a problem of our emergency departments. It's a challenge for our entire healthcare system, right out from people access their GP or public health nurse. And now our plan, which we published in July and we're focused on, has a series of actions right from where a person lives to the point at which they're discharged from hospital.
Just on a separate issue, a question for Minister Gorman. Sorry, Barry White from Newstalk. A noteworthy investigation published earlier today, Minister, found that 62 asylum-seeking children have disappeared from state care since after arriving in Ireland alone since 2017. It also found that 44 of said children are no longer being searched for because they turned 18. What's the explanation here, and is this a failure by government?
So as you know, over the course of the last year, we've seen a very significant increase in the number of people arriving seeking international protection and fleeing the war in Ukraine, and that's included an increase in the number of unaccompanied minors arriving in the country. Over the course of the summer, I became concerned at some of the numbers in terms of the issues of children in care and children missing for care. So I've taken a number of steps since then. Myself, I've engaged with the chief executive of TUSLA, Case Duggan. We've met with the TUSLA Separated Children Seeking International Protection team, and we've also subsequently met with the National Child Safeguarding Strategic Liaison Committee. So those are 2 organisations that work between TUSLA and An Garda Síochána in terms of the state's policy towards separated children in care. We've also, and TUSLA has commissioned the Children's Rights Alliance to bring together a number of relevant NGOs and stakeholders in the sector to look at the range of challenges facing children in care, including separated children in care, and looking at how we can address those challenges. The report of that will come out in January, and I think that will be really important in terms of identifying where we can act across government. And I think probably most importantly, Operation Cushneam is the operation that An Garda Síochána is operating in terms of protecting children from a risk of trafficking. And following my engagement with An Garda Síochána, that operation is currently being reviewed in terms of all steps that can be taken to see how An Garda Síochána is most effectively responding to situations where children are missing. I think one key change that has been brought in immediately is now whenever a child under the age of 18 is missing from care, there's an immediate case conference between An Garda Síochána, TUSLA and other relevant agencies as well. But that review of Operation Cushneam, my understanding, will also be coming out early next year, and we look forward to working in terms of following up on that.
Go missing from state care. Like, what's the explanation, and did the government have any idea, or do Garda have any idea where these children are? Where children who are under the age of 18 enter the country and they're identified as being on their own, the TUSLA is immediately informed that they've entered the state. Sometimes these children will have already transited out of the state before TUSLA becomes involved. So often they're just children literally transiting through the state, and they would be included in those figures. But that's not to suggest for a moment that the fact that any child who has been in the care of the state and is subsequently missing, that's not to suggest that that's not an issue of real concern. There is a clear program in place where a child in care is missing. It involves TUSLA, it involves An Garda Síochána, and it involves an investigation. The vast majority of children who go missing in care from the state in the year are found, and are found very quickly. A significant number of children do go missing every year and are found very quickly, but there are instances where children aren't found. As I say, in terms of the Garda operation, we're examining that to ensure is there any way that can be strengthened, and we've already taken one step in terms of an automatic case conference every time a child who is in the care of the state and goes missing, that case conference takes place. Thanks, folks.
Hello, Craig Hughes from the Irish Daily Mail. Bernard, the last board strategic scorecard provided to the Minister for Health gave the lowest possible ranking in the area of disability, so indicating that less than 50% of KPIs were within 20% of the remit. How can you be trusted to implement new reforms by the government if you've failed in this area already?
So the board strategic scorecard is pitched at a very high level. It's based on a corporate plan that's set out for 3 years, which is due to be renewed next year as it happens. And in that context, one of the reasons why the rating was low is that the roadmap for progressing disability services was something that we hadn't published and got to fully implement in the time that had been set out both by the corporate plan and by previous service plans. That did happen a very short time ago, ahead of the launch of this action plan. That's the first thing. The second thing is, as has already been discussed, there have been huge deficits in the capability to recruit sufficient numbers, particularly of allied health professionals, to give effect to all of the plans that we have to respond to children and to respond to their families. As I said earlier, I don't think the non-achievement of a plan of itself means that the plan is necessarily a bad plan. I think it means we have to reflect honestly to the public about what we are able to achieve in any one year, what we are able to do, and the attempts we're making to respond. I'm very conscious things like board strategic scorecards mean very little to an individual family with a child who has needs not yet responded to. And so ultimately, our focus is attempting to improve that. How can we be trusted? We are the state health and social care system. There isn't an alternative to that. And so I suppose my challenge as the CEO of the organisation since last March is to pull all of the levers that can make the delivery of services better for people with a disability as soon as possible. But I would never create the expectation that it's easy, and I certainly would never ever create the view, or seek to create the view, that we have a long way to go before we can say we haven't come up short for children with disabilities in Ireland.
I'm just wondering how likely is it to be able to kind of turn this around on the recruitment side? Because I know that the pay deal has happened, but you're still going to have massive challenges around psychology assessments of needs. Are they something that in the short term simply can't be turned around?
I think the challenge on the assessment of needs side is very obvious to everybody. I don't think there's any silver bullet to it in terms of quickly resolving it. I think there's a need for considerations around reform, right from policy to legislation through to how we do the assessment. What I'm more concerned about is while people have a right to an assessment of need, and that's a very important right, and I think it's very important that it's on the statute books, we have to find a better way to do those assessments and to allow us to also use the resources we do have to provide the intervention after the assessment. At the moment, the choices are often very stark between dealing with the number of assessments that need to be done, because people have a right to them, and there's nothing wrong with that right. But when all of the resource goes into assessment, very little goes into therapeutic response. So we're trying to find better ways to do that, but it is a significant challenge, yes.
Mr. Rabbit, are you satisfied with the performance of the HSE, given the failure to implement government reforms as highlighted in the BSS?
Absolutely. To be quite honest with you, Craig, I think the work that's going on between my department, between the HSE with Bernard here and his team, and the board, and the prioritisation of disability. And I'm very clear in saying that. I actually see blue light coming into disability because of the priority that they're prepared to put on it. And it's not just words, there's action. The rollout of the PDS roadmap, the production today in relation to the Disability Action Plan, and the preparedness and the listening to us that we actually have a crisis in disabilities and not actually tasking us also with a pause in recruitment. I think that shows that the HSE is listening and responding and give us an opportunity to recruit into the deficit areas. And when we talk about deficits, it's deficits not just in our CDNT teams, it's in our respite houses, it's in our residential, it's in our day services, it's right across disability. We haven't been attractive in attracting staff, and hopefully at the moment, while the embargo, the pause is on in the wider piece, we will actually recruit and start bringing some positivity and delivery, the most important thing, Craig, delivery to people.
Was originally from Minister O'Gorman, but he obviously had to leave, so wondering if you could clarify. Last week, Fine Gael Minister Neil Richmond indicated that the upcoming referendum to expand the definition of the family would make it easier for asylum seekers to bring their relatives to Ireland under family reunification. Do you see the proposed constitutional change impacting on the law in that way?
Actually, Ben, to be quite honest with you, I was so busy getting this ready today, I actually had missed that commentary completely. So I'm not going to comment.
Sure, fair enough.
Thank you. Thank you. That's lovely. Tom, how are you doing?